According to the National Institute of Health, running is one of the most popular leisure sports. Unfortunately, according to statistics compiled by Yale Medicine, at least 50% of regular runners get hurt each year. Some estimates put that percentage even higher, sometimes from trauma, such as a fall, but more often from overuse. The NIH goes on to state that 50 to 75% of all running injuries appear to be overuse injuries due to the constant repetition of the same movement. Their advice? The prevention of sports injuries should focus on changes in behavior through health education. Health education on running injuries should primarily focus on the importance of complete rehabilitation and the early recognition of symptoms of overuse and the provision of training guidelines. We are fortunate to have a guest today who is very knowledgeable in all these aspects. Hello and welcome to episode number 21 of the Blue Water Running Podcast. I'm your host, Maren, and this podcast features and celebrates the accomplishments of high school and collegiate cross-country and track and field athletes from the Blue Water area of Michigan. Today's episode is a special edition with a guest who has a lot of great perspective and advice to help us runners of all ages remain healthy and able to do what we love for the rest of our lives. Dr. Kyle Casadei is a non-surgical orthopedic and sports medicine specialist at the Center for Advanced Orthopedics and Sports Medicine. He received his medical degree from Michigan State University College of Osteopathic Medicine. He completed his residency in family medicine at Henry Ford Macomb Hospital, where he served as chief resident and was named Resident of the Year by the Michigan Association of Osteopathic Family Physicians. Following residency, Dr. Casadei completed a fellowship in sports medicine at Henry Ford Hospital, where he treated injuries of the knee, shoulder, hip, elbow, foot, ankle, hand, wrist, and spine, as well as concussions. He also was trained in ultrasound-guided injections and osteopathic manipulative therapy, known as OMT. As part of his fellowship, he provided training room and game coverage for the Detroit Pistons, Detroit Tigers, Detroit Lions, the Motor City Cruise, Wayne State University, and high school athletes, as well as event coverage for the Detroit Marathon, U.S. Hockey 16U National Championships, and NCAA Division II Golf National Championships. Dr. Casadei serves as the team physician for his alma mater, Rochester Adams High School. He is also an active member of the American Medical Society for Sports Medicine. Special thanks to my collegiate teammate, Dr. Stephen Klein, for connecting us with Dr. Casadei for today's episode. Welcome to the Blue Water Running Podcast, Dr. Casadei.
Thank you. Thanks for having me.
Yeah, so let's start out with a few questions about you and how you became a doctor, how you got into this particular field. So tell us about how you decided to specialize in sports medicine and what drew you to this particular field.
So I was not one of those people that always knew I wanted to be a doctor from the time I was really young. I grew up in a family of people who are in real estate and didn't know any family members or really like close family friends who were doctors. But like a lot of people who ended up in sports medicine, I grew up as an athlete dealing with injuries. And junior year of high school, ended up getting a concussion. And it took me about 3 months to really get over that. I had a nonstop headache for 3 months. I was out of sports for about 3 to 4 months. And during that time, I was seeing a sports medicine doctor almost every week. And he made a really big impression on me. So junior year for me was a time when I was starting to think about what I wanted to do with my life. And I had this experience where I was seeing this sports medicine doctor over and over again. And I realized I was interested in what he was doing. So I ended up shadowing him shortly after that injury and liked that experience. And I guess the rest is history.
So as a sports medicine specialist, what types of injuries do you see the most frequently in your patients that would be attributed to a direct result of running or running related sports, such as cross country or track or field?
I see really a big variety of injuries the big ones, stress fractures, shin splints, are the really common ones, as well as patellofemoral syndrome, which is also known as runner's knee, which is basically where the kneecap or the patella is not tracking correctly as you're running, which can cause knee pain. IT band syndrome, very common in runners as well, and then hamstring and quad injuries, which is more so in the more shorter events in track, as well as growth plate injuries. So growth plate inflammation of the bones around the hip and the pelvis, as well as growth plate fractures in the pelvis as well, obviously in the younger athlete population that are still growing.
So, do you see any injury distinctions between a distance runner and a sprinter? So, are there certain injuries or issues that are definitely more prevalent in those athletes that are doing those short explosive movements versus somebody who is running for an extended amount of miles?
Yeah, definitely there's a distinction. The more explosive events are going to be more of the acute injuries, like a hamstring or quadricep strain, where you feel a sudden event happen with a forceful, short, sudden movement. Avulsion fracture is also going to be common in that population, where maybe as you take off the blocks and feel a pop in the around the hip, then that's concerning for an avulsion fracture in an athlete of the right age. Whereas distance sports, typically more repetitive overuse type of injuries, like the patellofemoral pain that I mentioned, IT band syndrome, shin splint, stress fracture, things that are more related to the repetitive activity of running, and oftentimes other things, diet related and things like that, can play a role in that too.
Right. Could you touch just a moment on what an avulsion fracture is? Because we had a student on my daughter's team this year suffer one of those, and I don't think that that's a really well-known injury, but it seems to be quite common in younger athletes.
Yeah, so in athletes who are growing, the tendons from the muscles come in and attach onto the an area where the growth plate is. So when the growth plate is open, the weakest part of that muscle tendon bone unit is the growth plate. So it's oftentimes most common for growing athletes to have a growth plate injury more so than a muscle or tendon problem. And so what happens in going back to sudden sprinting example, the muscle and tendon pull on that growth plate and it pulls the growth plate away from the rest of the bone. And we call that an avulsion fracture, where the bone has separated itself from the rest of the bone.
Well, this is a great segue into my next question for you, which is many of our listeners are high school athletes or middle school who are competing in still growing bodies. Many of them are going through major growth spurts as they're competing in athletics or hitting puberty. They obviously are not in adult bodies yet. So, what specific advice would you have for them in order to remain healthy and injury free as they're competing through their teenage years?
Yeah, good question. My biggest advice is really diet related. So I think that's really underappreciated in a lot of these athletes in terms of the advice that they're getting. The So in general, the just getting enough calories into your body to support all the energy that you're expending when you're running, especially for distance runners or the track athlete who's also playing soccer or another sport, that amount of activity level puts a lot of demand on your body, and you need to make sure you're getting enough calories to get nutrients to all the bones and soft tissue structures. So as a general goal for an athlete training 2 or 3 hours per day, 5 or 6 days a week, you should be consuming somewhere between 40 and 50 calories per kilogram of body weight per day. So for a 120-pound athlete, that would come out to somewhere between 2,200 and 2,700 calories per day, which is quite a bit just to be able to support everything that your body needs for that amount of activity level. And protein intake plays a big role in that too. So we can take some of the protein out of that total calorie number, and about 1.4 grams of protein per kilogram of body weight would be a good goal. So going back to someone who's 120 pounds, that would be somewhere around 75 grams of protein per day. And not that we necessarily need to track all these things on a daily basis, but to have a good general idea of a few things that you're going to have for a snack or a drink throughout the day that you can get some protein and calories into your body to really support everything that your body needs to continue to perform.
So I'll ask you from the mom point of view, do you push athletes towards a certain kind of protein so that it's a quality calorie intake, or are you just calories are calories?
Yeah, no. So if you're able to eat protein, that's going to be the best way to get protein intake. Um, if you're going to do like a protein drink or something like that, I prefer the protein drinks as opposed to like a more processed protein bar. But you're kind of splitting hairs at that point. But the protein powders, you should be getting something that's certified by a third party so that you know that it's what they say is in that substance is actually what's in there. So um, there are different certification bodies that test these things for professional athletes, for example, who are going to be drug tested so that they know that what they're putting in their body is actually just protein or creatine or whatever the supplement is, and there's not actually steroids or something else that could be harmful.
Yes, that's definitely good advice. Well, as we move into looking at some tweaks and some aches as the season gets started for cross country, what are warning symptoms or signs that runners definitely should not ignore, even if they are not, quote, technically injured yet, or they haven't been forced to stop running due to pain or an acute injury? So, what are things that we should be looking for? Like, hey, these are warning signs, don't ignore them.
The biggest one we kind of touched on a little bit with the growth plate injuries. There's growth plate injuries are kind of on a scale or a spectrum where at the beginning you can just have inflammation where there's not a fracture. And if that continues, if let's say you have growth plate inflammation where you're a little bit sore, but you're still able to run, but then your body is trying to tell you that if you continue to do that activity, you are at risk to develop that avulsion fracture that we talked about. So if you feel something that's a little bit abnormal, doesn't quite feel right, especially in the growing athletes 10 to 15 years old, that's something that we should get checked out so that we can make sure that this is not a growth plate injury and you're not at risk to have a fracture. And the reason we get worried about it is because for an avulsion fracture, that's typically something where it's going to be about 3 months of really no running at all. And then starting a gradual return to run program after that, it could be 4 to 6 months to get back to full running. So obviously, if we can avoid that with a shorter rest period on the front end, that's going to be better for everybody. So that's one thing. And for the girls and women listening, if menstrual cycles are changing, where you used to have a regular cycle and it's becoming irregular, that's a sign that your body is not getting adequate nutrition, or it could be a sign that your body's not getting adequate nutrition. So that's something that I tell people to look out for, because that would potentially put you at higher risk for stress fractures and other bone related injuries. So that's something where if you're starting to notice that, we need to look at the nutrition and activity level and see if there's something that we can optimize in terms of those things. And then the other thing is kind of the $1 million question is always, is it shin splints or a stress fracture? And
Mm-hmm.
so general rule is if you're painful over a more in the muscles around the lower leg, that's more consistent with a shin splint. If you're painful over the bone, and especially on the back side of the bone, that's more concerning for a stress fracture. Especially the thing that makes me concerned is when someone says it used to bother me when I would run and I could run 3 miles before I really started to notice it, and then I could run a mile and a half before I could notice it, and then I couldn't run at all, and then it started to bother me when I was walking. That's concerning for a stress fracture.
Mm-hmm.
So those are the things that I would look out for so that we can kind of catch these things before they turn into a bigger problem where there's going to be a more prolonged time away from running.
Right. Well, I did a podcast episode with an athlete who suffered from an eating disorder while she was a high school athlete, and she talked extensively about how her decision to restrict her calories and to overtrain has now affected her into her collegiate running with her bone health and then also her fertility. So it's really important, like you mentioned, for girls and women to make sure that all those things are being cared for properly. So all right, what are some preventative measures or maybe some daily things that athletes of all ages could do or implement just to keep them basically injury-free as much as possible?
Yeah, the diet we talked about, but other things, obviously you want to take care of your mobility in terms of hamstring, quad, hip joint, calf, ankle, all of that stuff. Because if one of those things is tight or not moving correctly, then it's going to alter your gait pattern. And especially in a distance runner who might be running 30 miles a week or significantly more at the collegiate level, any small imbalances is going to be exacerbated, and you're gonna put yourself at risk for injury. So that's a big part of it. Any changes in mileage or terrain should be really gradual. So we don't want to go from 30 miles a week to 50 miles the next week. And I'm also a big proponent of gait analysis. So if what I've in talking with physical therapists who work with a lot of runners, one of the things that they find a lot is that cadence is often too slow in the amateur runner, which means each stride is going to be longer, and therefore you're essentially putting more impact on your body with each of those strides. So increasing cadence for most runners can decrease risk for injury, especially with the stress fractures and shin splints. So that's something I'm a big proponent of, that if we can optimize mechanics, then we can avoid a lot of injuries or at least minimize them.
So speaking of gait and injuries related to how you're striding or running, I've heard a lot through various sources and family members that if you're a runner, you're going to ruin your knees running. Or if you do a marathon, you'll need a knee replacement, when you're older because you're going to chew through your knee tissue. So, do you see any truth to these kind of statements? I mean, are there any instances where that could be true, or is this really disproved by science and what we know about the knees today?
Yeah, this has been disproven for the most part. So essentially, if assuming you don't already have an arthritic process or some kind of degenerative process, then running has actually been shown to be protective in terms of knee arthritis specifically. And the thought process with that is that running strengthens the supporting muscles to better support the knee joint and protect against arthritis. And there's also probably a confounding effect too, where runners in general are likely making healthier choices than the general population in terms of diet and other activity level, likely carrying less body weight than the average person too. But yeah, this is not something that I have a concern about. It's actually been shown to be protective rather than a risk factor for the most part.
If anybody has a poor stride mechanic or if they are running with bad form, could that contribute possibly to more knee issues or if they have, weak surrounding muscles as well?
Absolutely. Yeah, that would be one of the things that I would want to get addressed quickly before that runner starts running 60 miles a week in college.
Right. All right. If you could give us a number one tip to remaining a healthy runner or an athlete for the majority of our lives, what would it be?
I'll cheat and do two of them. So,
Okay.
pre- prepare your body on the front end with diet as the biggest thing, and then on the flip side, if you start to feel something that's not right, listen to your body. So we always say runners run, and I know that and I get that. But if we're able to rest for even a handful of days, if you start to feel something, then that's oftentimes going to be the best thing rather than trying to push through it and then you turn a week off into 3 or 4 months off.
Yep. Being proactive. That's what we're always telling athletes. So, all right. Well, my last question is just a personal one for you. When you are not working with patients or at work, what is your favorite thing or hobby or spare time activity that you like to do?
I have a 3-year-old daughter and a 5-month-old son now. So in the summer, I really enjoyed walking with my daughter to the park we have in my neighborhood. She just got a bike, so we're teaching her how to ride the bike. So that's been fun for me, really.
Well, I want to thank you again for taking time out of your day to join us and give us lots of great tips and advice for keeping our growing bodies and older bodies healthy as we're heading into a lifetime of running. So thank you once again for joining me on today's episode.
Thanks for having me. Have a good rest of the day.
Thanks, you too. I'll leave you with Dr. Casadei's favorite quote by American swimmer Mark Spitz, which is especially relevant considering our conversation on this episode. If you fail to prepare, you're prepared to fail. Mark Spitz was a 9-time Olympic champion in swimming and was the most successful athlete at the 1972 Summer Olympics in Munich, winning 7 gold medals, each in world record time. This achievement set a record that lasted for 36 years until it was surpassed by fellow American Michael Phelps, who won 8 golds at the 2008 Summer Olympics in Beijing. Phelps, like Spitz, set 7 world records. If you enjoyed today's podcast, please share and subscribe. You can find the Blue Water Running podcast on Apple Podcasts, Spotify, your smart speaker, and other major media players. If you have an idea for a great topic or guest you'd like to hear about, feel free to contact us through the website links or show notes. You can follow Blue Water Running on Instagram, X, TikTok, Facebook, and YouTube. You can also find meet and athlete reports and articles at www.bluewaterrunning.org. Coverage on Blue Water Running is sponsored by Elite Feet of Port Huron. If you need running shoes, spikes, or running apparel, they have a friendly and knowledgeable staff to help you find exactly what you need. They are located at 327 Huron Ave in downtown Port Huron.